What are you feeling as you're seeing the elevator here?
A little anxiety.
You look a little squeamish, like you want to step aside from the elevator.
Mm-hmm.
Okay. What I wanted to show you was that elevators are something that you can get up close to. They're not going to come after you. They're not going to do anything right at this point. Because look how close I'm standing to this elevator right now. You see where I am?
Yes.
In fact, I'm really right up here against it right now, aren't I?
Yes, you are.
Okay. And here I am. I'm touching the number on the floor here.
Mm-hmm.
And
if the door
touching the
opens
outside thing.
and the elevator's not there, you're going to fall.
Do you think that would happen?
It could.
Okay. What do you think the chances are that I would open it and the elevator wouldn't be there?
I don't know.
Remember we've done those things before with how
Percentages.
frequent the chances are that things would actually happen like that?
Yeah.
Okay, so we did the thing in the cafeteria with the risk of your tray actually falling out of your hands.
Right.
So you have to think about what the risk would be of an elevator opening and there not being an elevator there.
The risk is pretty low, but in my mind,
In your mind,
at
it's
the time,
very likely, isn't it?
it's high.
Yeah. If we're realistic about it, what do you think the chances are that I would press this button, the doors would open, and there would be no elevator there, just an open floor?
1 in a million, probably.
Yeah, 1 in a million. I don't know, maybe many more than that. I've ridden a lot of elevators. I've certainly never seen it happen. And then we can even go, let's say if I'm standing here and it opens and there's no elevator there, what are the chances are that I'm going to fall into that hole? Am I
Well,
going
what
to
if you
jump in there?
didn't look and you went to step off?
Well, I think I'm going to look before I step into something.
Okay.
Okay, so I think I'm going to show you how this would work.
Okay.
Is it okay with you that you could actually be beside me as I press the button and call an elevator and at least go partly into an elevator?
Sure.
So what I'm going to do is I'm going to show you how to press the button. I'm going to go into the elevator, and then I'm going to step back out again, which is something you can practice. if
Are you
get
going to leave
comfortable
me
going
in
into
there?
the elevator. No, you're going to
Oh,
stay
good.
watching me.
Okay.
In fact, let's see, there's an elevator right there. Can we go over and check that out?
Sure.
Sir, would you mind if we hold this elevator? Thank you very much. You can just watch me. I'm going to go in here. And I can just actually hold my hand on the side of the elevator, and there's an electric eye here, so it's not going to open because I have my hand on that. There's also a button in here which will open the elevator. And if I press it, it keeps the door open,
Okay.
like this, so I can stand here and talk with you.
Okay.
Now I'm seeing a number of buttons for the floors here. So listen to these sounds now. Now when you hear these sounds, what does it feel like to you?
Panic.
Does
This is
it?
a panic
Okay,
button.
this is just telling me that someone's holding the button and they think it probably is a good idea if the elevator goes on its way. So this gentleman's very nice and has been listening to this, so I'm going to go ahead and let him take the ride, and I'm going to step back out again.
Okay.
Is that okay?
Yes.
So here we go.
All right.
Thank you very much, sir. Okay, so you've been very good at watching this. I can tell you're just getting a little
My
bit
hands are
nervous.
sweaty.
Sure. Remember our basic idea about how to handle anxiety disorders, that one of the things is that we have a pattern of avoiding things because we have a built-up fear of how bad it's going to be. And every time we avoid it, that makes the fear worse.
Yes.
So our strategy here is to learn ways to break this pattern of avoidance.
Okay.
So what do you say we call another elevator? You try to step in and out of the elevator with me, just like I did.
Okay.
Would that be okay?
Mm-hmm.
Okay, let's see, we'll just press the button here. In fact, could you press the button, or would you like me
I
to?
can push the button.
Great. Great, excellent. So there we go. So let's see, we'll take the first elevator that comes. There are, I guess, 4 of them right here.
Okay.
All right.
I don't know if I can get in it if it's crowded,
Okay, well, if it's not, then we'll catch the next
because then I
one
feel
here.
like I'd be stuck.
Okay, we'll talk about that one once we finish this exercise, about
Okay.
the likelihood of being more stuck if there are more people.
Okay.
Well, let's see what happens here with the elevator. I think we're going to get one pretty soon.
Mhm.
Now, you see a sign here that says, in case of fire, use stairs, not elevators.
Yes.
What do you think when you see that sign?
That the fire would just shoot right up the elevator shaft.
Okay. Well, they do have a fire sign right there, don't they?
Yes.
Okay, so probably it is a good caution that when there is a fire to take the stairs. That's what is generally recommended. Okay? Now, here's another elevator. In fact, this is the one that I was in earlier.
Yes, it
so let's
is.
walk over. And I'm going to step inside, and I'm going to help a little bit by holding this. Could you
Okay.
just step inside with me for a moment?
Okay. I'm breathing.
Okay. Remember your breathing, your normal breathing? That's excellent. That's fine. I have the button. I'm holding it just like I did before.
Mm-hmm.
Why don't we see if we can wait until that buzzer goes off, and then we'll step outside.
Is that my panic button when it goes off?
No, it's not the panic button. It just tells us that someone's holding the button for a while. So there we are. Can you look around the elevator?
Mm-mm.
You can't.
No, I want to look at the door.
Okay. We'll do that another day. Let's just take a quick look upward. Here's this nice glass panels on the top.
Mm-hmm.
Here's a little advertisement for the Nurse of the Week,
Okay.
which is very nice.
Yes.
Okay. In fact, it's a very beautifully designed elevator here. Okay. So now we said we'd step out. So you ready to
Okay.
do that? Okay. Excellent. Great. So that was our experience with actually stepping in and outside of an elevator. And I think it's probably been some time since you've done that, hasn't it?
Yes, it has. Months,
Okay.
maybe a year.
And how do you feel?
Well, I was pretty anxious while we were doing it, but I guess now there's a sense of accomplishment. But it didn't
All right.
fall.
Good. Yeah, it didn't fall.
It didn't fall.
There was actually an elevator floor there,
There
wasn't there?
was.
Yeah.
I looked.
As you predicted. You did check it out? Okay. Well, it's pretty good to look before you get into something like that.
Yeah.
All right. Well, what we're going to do today is stop for now because we've had, I think, a good experience with this, and then we'll take another day and we'll come back and,
Okay.
and try to do some more things with elevators.
Okay.